All right, welcome back to Yahoo Finance Live. Miles London here in New York. We're joined now by Dr. Cyrus Shahpar. He's a former team lead of the CDC's Global Rapid Response Team, currently a director at Resolve to Save Lives. So, Dr. Shahpar, thanks for joining the program today. And I just want to start with your view of the coronavirus outbreak here in the United States as it stands on April 6th. The market today, investors who are not medical professionals, they are looking at what's happening in the tri-state area, and they are excited by those trends. As you see the virus outbreak right now, are you as encouraged by some of that data?
I'm encouraged that the New York situation seems to be flattening out, but you have to understand there's a lot of room to grow in the rest of the country. And the way we've implemented measures across the states is uneven. So we have more ahead than is behind us.
So let's talk about that implementation. It's been uneven across the country. There's certainly signs that social distancing works. That's kind of the long and the short of it. As you see the response broadly, and you look back to the last few weeks, what are the things that have been the biggest mistakes, and what are the things that actually are helping us now and are strategies that we need to kind of push ahead with?
Yeah, we kind of had a delayed onset, January, February time. We had delayed rollout of lab testing, which gave us an incomplete picture of what's going on. We really were flying blind for a while because we didn't know who was infected or who wasn't. So we told everybody to stay inside, which is a good strategy. I think, moving forward, like I said, we have a lot more room ahead, and it's important for the whole country to be on the same page. Otherwise, we're kind of limited by the least protected group, because as a United States of America, really the situation as a whole depends on whoever's the most vulnerable in terms of states. There's 8 states out there which don't have a statewide order to shelter in place right now, which means they haven't started the process to have physical distancing help their populations. States like South Carolina, Arkansas, Wyoming, Utah, Iowa, North Dakota, South Dakota, I think there's another one in there. Those states they have cases and they haven't told people to stay inside, which means that's just going to delay the whole country in recovering from this.
Hey, Dr. Shahpar, Rick Newman here. So investors today seem excited that we're getting some signs of flattening the curve, but flattening the curve is a waypoint, not an end point. So we can get to a point where we're all socially distanced and we begin to contain the virus. But what do we do then? That doesn't mean restaurants and nail salons are going to reopen. So what are the steps we need to get through where we can actually begin reopening those businesses? And how long do you think that's going to take?
Yeah, right now, everybody, the government's told everybody to stay home for April. At the same time, the government and the healthcare system needs to be working really hard to have society be in a place to be able to release people back into society. And that means they need to have good ways to track the virus. We need to have a healthcare system that has too much PPE and healthcare workers, not too little. And we need to have public health systems to be able to find cases when everybody goes back out there, test them, and isolate them so it doesn't spread into the population. But this is just the beginning of what we see and others see as several peaks in terms of the virus. It's not going anywhere. So just because we say it's over and it's better, we're going to see a rise as people re-enter society. And are we equipped to deal with that? And do we have to turn some things back on? That's the general strategy every country in the world is talking about. So it's not like this is going to be over May 1st and then we're all going to go outside and everything's going to be back to normal. There's still virus out there and still people who are susceptible. So what is the strategy moving forward, and how do we get ready to do that?
So, Dr. Shahpar, you have an MD from the University of California, Irvine. I also see you have an MBA from the University of California, Irvine. So you kind of got both sides of the brain working, right? You got the medical part and the business part. So you understand when people want to open their businesses up. But it's sort of a little bit of a follow-up of what Rick just asked, but how do we possibly make that call? President Trump, the cure is worse than disease and all that kind of stuff.
Yeah, I mean, there are essential services that could open. We could have better testing that tells us who perhaps has immunity and can go out safely. Serologic testing is coming. The first test was approved in the United States within the past week. As we get better information about the virus, who has it, if we have immunity, then parts of society can open safely. And it's just increasing our ability to figure this out, to learn who has the virus, to have the healthcare system be ready to take care of people who get severely ill, and to trace those and say, hey, you know what, you have coronavirus active right now, you should stay home. Be better about that kind of information. Right now, it's more blanket guidance because we don't have that granularity of information. But we do need to restart essential services at some point.
All right, Dr. Cyrus Shahpar, formerly with the CDC, currently with Resolve to Save Lives. Thanks so much for the time today, and we'll talk to you soon.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.